Right, so we will go through the whole sort of procedure, because the thing at the end of a day like today is you want to know, when do you use this? You've got all the markers, you can't wait to get started, and then you get stuck with the first patient. So let me just finish off a couple of things to make sure that you've got all the tools. Now the first thing that we want to do just now is look at vitamin K. Okay, K is one thing that was always considered to be involved with blood clotting. K is for clotting. So it's a group of vitamins. Not very much is written about the exact way that one form of K can convert into another. We know certain food sources which are rich sources of the different types, and they know how to make it synthetically, but the difference between K1, 2 and K3, how the body can convert itself, nothing I've seen really, it tells me the chart, like the vitamin D chart. You know, I like we hydroxylate here, we change this to there. So we haven't got all the markers of how to do that at the moment. So it's related to modification of proteins that allows them to bind to calcium ions. So this is rather important because it's thought that particularly the K2 can actually get calcium into the tissue, whereas D elevates blood calcium level. We need to get it from the calcium then into the tissue, which may be the job of K. So without K, blood coagulation is seriously impaired and bleeding can occur. Low levels of K also weaken bone and promote calcification of arteries and other soft tissues. So this is quite important, again, of getting the calcium. We don't want just the high calcium in the blood. As a result, we want to get it into the bones and the tissues. Chemically, the K family include two natural forms, what are called K1 and K2. K2, in turn, consists of a number of chemical subtypes with different lengths of carbon chains. K1 is synthesized by plants, and this is found in highest amounts in leafy green vegetables because it is directly involved in photosynthesis. So this is what you get from your greens. So you eat your greens, you get your K1. Animals may also convert it to K2, and this is the pathway that I can't really find anything on, of how do we do that. But we do know that K2 is produced by bacterial fermentation. So we produce it to some extent in our guts, providing you have the right bacteria in your gut to begin with. Now, Jill talked about that with biotin. Do you remember this just earlier on? Biotin, choline, and inositol are so-called non-essential vitamins, so they don't have a vitamin B number on them, and because you should be able to make those in your gut with the right fermentation, with the right probiotics. But it's finding the right one, and we can't identify a specific probiotic that makes a specific B vitamin. We thought we had, and then suddenly you get another one come up with another person. But she mentioned about biotin. The most common one with biotin we find is acidophilus. Now the two of the 7 or 8 probiotics that we now do and the mixture that we do, I find the most common is probably acidophilus, which comes up the most, followed by Bifidobacteria bifidus, the large intestine one. So bifidobacteria live in the large intestine and are anaerobes. Lactobacillus live in the small intestine and are aerobes. Right? Those two are the most common ones that I personally find. So if you have a person who shows up to biotin, think, as Jill said, think about the gut, look for probiotics. And this is why I said earlier that when we test a person who's got hypoxia, even probiotics can change it. And I think one of the reasons the probiotic may change it is because it improves the production of choline and biotin and so on, which in turn then help metabolize ammonia, and so then it reduces the hypoxic effect. So anything can cause anything at the end of the day, can't it? So how the body converts K1 to K2 is a bit of a mystery, but we know we can get through fermented vegetables, things like sauerkraut and so on, we can obtain K2 naturally. It's the main storage form in animals, and has several subtypes which differ in their chain lengths. These are called Menaquinones. So Menaquinones are abbreviated to MK with a number. For example, Menaquinone 4 is abbreviated to MK4, and obviously MK7 is the other one which is most common, MK7. Menaquinone chromophore is the most common type of K2 in animal products. It's normally synthesized from vitamin K1 in certain animal tissues, artery walls, pancreas, and the testes. This homolog of vitamin K2 may have enzyme functions distinct from K1. Bacteria in the colon can also convert K1 into K2. In addition, the bacteria produce a range of K2 forms, mostly MK7. So we need a good gut. Okay? So if you haven't got a good gut, you have to take it in from natural sources, from the food. So fermented vegetables like sauerkraut, etc. And my favourite is brie. So brie cheese is the highest source of K2 that you can get, really, apart from the dreaded natto. Now, the downside of natto is it tastes disgusting. Okay? So you can get K2 derived from natto, which you put in a capsule and you don't taste it and anything. But soya, it's a soy product, and soya is not necessarily something good for a lot of people these days. I'm not totally convinced that the soya product that you get it from is also not GM. Unless it actually specifically states that it's organic and non-GM, you have to assume that all soy-derived products are GM. But there is actually a better source than all of this, which is more natural to me, and obviously fermented cheeses are one of those, okay? But there's another source which is even more pleasant than the cheese. So let's have a look. Okay, MK7, menaquinone, is different from MK4 in that it is not produced by the human tissue. MK7 consumption has been shown to reduce the risk of bone fractures and cardiovascular disorders. So the MK4, MK7 is a big family, and you can't convert one necessarily to the other. So getting a broad diet with good colonic bacteria and plenty of fermented goods in there is excellent to get both types that we need. So MK2 as MK4 but not as MK7 has been shown to prevent bone loss. So both MK4 and 7 are important, and that loss may be caused by corticosteroids, anorexia, cirrhosis of the liver, menopausal, disuse from stroke, Alzheimer's, Parkinson's, etc. So we may lose our bone density because of that and need extra K. K may regulate bone metabolism. In other words, the osteocalcin, the bone protein in there. MK7, which is abundant in fermented soybeans, especially natto, has been demonstrated to stimulate osteoblastic. That's the cells that stimulate bone growth. And to inhibit osteoclastic, which is the ones that stimulate the resorption or breaking down. MK7 has also completely inhibited a decrease in the calcium content of bone tissue by inhibiting the bone reabsorbing factors. Now, this is where it starts to go back in history. Now, some of you will be familiar with the work of Weston Price. Weston Price was a great nutritionist back in the 1920s and 30s. He was a dentist. He was completely appalled by the state of teeth in Ohio. So scientists in there practicing dentistry in Cleveland, Ohio, he was amazed at the poor state of his patients' teeth and the suffering it inflicted. Okay? Nothing's changed really, has it? So some people say the state of teeth is not much better now than what it was in the 1920s. Activator X, he came across, he studied all over the world. He searched, and these people did in those days. They went around the world and looked at all sorts of societies, and many times they went to places where, they were forbidden to go to, like in Tibet and China and so on. And there were areas of the world where people had no dental caries at all, whereas the Western type of diet in America and Europe tend to create dental caries. And we know the obvious sort of offenders with that, with the fluoride, with the sugars and things, and whether fluoride is useful, whether it's not, and the ratios of calcium to phosphorus and so on are all very, very important to dental caries. But he found that to stimulate enamel growth, these primitive societies ate primitive foods, and nothing complex like the sugars and so on. And the two most important factors that he came up with was cod liver oil, which was the major source of vitamin A and D. And the second one was unpasteurized butter. Unpasteurized milk, that is, which was then turned into butter. Okay? So those two combinations, he actually found the enamel regrew in people with dental caries. Okay? It's a magic combination, this. I personally have never found cod liver oil. I've tried all sorts of makes of it, all sorts of claims, and people don't seem to strengthen the cod liver oil. And one of the reasons is that it contains both A and D. Okay? Now, this can be inhibitory. One can inhibit the other. They compete, in some cases, for the same receptor site. So if A gets there first, D can't get in and switch on the D, and vice versa. So A and D have got to be kept strictly regulated. Now, there is no rule of thumb that you need twice the amount of A to D or D to A. Nobody really knows that. But obviously the natural source in the body uptake from liver is generally considered to keep that balance. There's no harm in taking as much beta-carotene or carotenoids, providing the carotenoids convert in the first place to the active forms of A. So I want to spend a few minutes in a minute teaching you about vitamin A, because vitamin A is exactly the same as vitamin D. You will never find vitamin A deficiency if you test with the wrong one. You've got to test with the activated forms for that person. Okay, but first let's finish off with K. So what he found is the best source of A and D together was cod liver oil. But we may find that a person doesn't strengthen cod liver oil because they only need the A or they only need the D. Okay? So Western Price used extracts from grass-fed butter. Now this is the thing about this. He called it activator X, or factor X factor. What they did is they got cows to eat grass which was growing very fast. This would be in about May, June time, when there was plenty of water in Wyoming and places out on the Midwest there. So you know that if an animal eats grass, very quickly it blows up. You know, it ferments. And that's great, because all that product of the fermentation in their guts gets into their blood and then comes out in the milk. Okay? And so you're actually making a natural organic process of using that milk then to make butter, because it's a fat-soluble vitamin, vitamin K. So what you do is you do away with all the water and you make butter. And that butter is the richest butter you can buy. Okay? A small pot like that costs £45. Okay? So, but you don't need very much of it. You don't sort of spread it on your muffins and things, you know. Okay. But it mixes beautifully with the vitamin D. So we call this vitamin D X, Smart D X. So if we've got a person who strengthens to the X factor, then you give them DX, because it's got the organic pasture-fed butter, high vitamin content butter it's called, because it's rich in the K. Now, some people say it's not K in there, and other people in the Western Price Institute say it is. So we don't put on there contains vitamin K, because if we put on vitamin K, we have to tell you how much K it is, and nobody will tell us how much K is in there. Okay? But we all know it's pretty good stuff, okay? And it seems to work. When you've got a patient who's deficient in K2, the butter compound works really well. Now that's what we put on there. That's why I haven't called that K2 at this stage, because there's many other things in butter, and it could be one of the many oils that contains a lot of CLA and other things. In there, the DX is a 10%, so that you've got 90% black walnut, black cumin seed oil with your vitamin D in it, and 10% is your high-strength butter from the grass-fed with the vitamin K in, or the X factor. So in your selection of vials that you've got, there's activator X, I think it's called, isn't it? Okay. Activator X, some people call it X factor, some factor X, and so on. That's what it is. It's an extract of the butter. So if a person strengthens to that,
No,
what? You haven't got activator X in there?
No.
Where's the activator? We have got some. Okay. How many have we got? Enough for everybody? No. Okay. So what is it? First come, first served? Okay. All those beginning with A to M. Or telephone numbers, car number plates with odd numbers on. Okay. So anyway, we will make sure that when you order, next time you order, just order an X factor with it. Okay. Just say, could I have the free X factor that I've been promised? Okay. So the X or activator X, if activator X or X factor shows, then you use the vitamin D X, okay, because it's got the vitamin K in it, right? Does that make sense?
Is that what you're calling Smart DX?
Smart DX, yes. So don't get confused between Smart D and Smart DX, because Smart D is just when you need the D, and the DX is when you need the vitamin K as well. So some people may change. They may need the D for a while, and then they start to show they need the K as well. But if they have a nice slice of brie, then they won't need it. Okay, you get ample amount from brie, or any other fermented cheese, or fermenting their own vegetables, or sauerkraut. If you have fermented vegetables or sauerkraut, you must always remember that they must be organic. Okay, you go to the supermarket and buy sauerkraut, you'll be dead. You know, with pesticide poisoning. Okay, so activator X is the grass-fed rich butter. It's probably the most sensible thing in the whole thing is to ferment your own inside the cow. Use the cow for the fermenting. Butter is a much more natural substance for us in the West than fermented soya goods. In combination with the high cod liver oil, but we would use specifically vitamin A or D to prevent and reverse dental caries in many of his patients. Isn't that interesting? He actually reversed it. I wonder when that was last actually ever done. Now, it's also known, activator X, as the Wurzen factor. I thought it was Wurzel factor when I first read about it. It's known as the anti-stiffness factor. And what this means is you need to get the calcium out of the tissues and into the cells where it belongs. So, Sue, you didn't actually show to this, but you've got the stiff factor. And this was the first thing that they looked at, called the Wurzen factor, or anti-stiffness factor. Now, they thought it was a plant sterol, first of all, which acted like a cortisol and reduced the stiffness in inflammatory problems. But they're now pretty certain that it's K2. But it's known as the Wurzen factor after, I think she was Jean Wurzen, who was the person who discovered that this released people who were very, very stiff. So the stiffness is caused by deposition of calcium, and to get that calcium back into the tissue, into the cartilage and things, you need this activator X. And there were 3 vitamins he found abundantly in the diets of healthy, non-industrialized people, A, D, and an unknown substance he called activator X. He considered them all to be synergistic and critical for proper mineral metabolism, especially bones and teeth, and general health. He had a chemical test for activator X, but he didn't know its chemical structure, and so it remained unidentified. He found activator X most abundantly in grass-fed butter, but not grain-fed, organ meat, shellfish, insects, and fish eggs. In 2007, an article on the Western Price Foundation website claimed to have identified Western Price's mysterious vitamin as K2, specifically MK4 form. However, there is absolutely no conclusive scientific evidence that MK4 or K2, for the matter, is activator X. It could be a host of other substances, even a complex. So we don't know at this stage, whether it is actually K2 or whether it's just a group of substances. Now, to more or less finish off here, I want to just go through a little bit about vitamin A. Okay, then you've learned a little bit about K. D, you've learned a lot about D, I hope. Now you need the other component to this, which is the A. And A is like D, it has to be activated. And I can't remember again, like the D, when I last gave prescribed vitamin A. I have occasionally, but when I looked down the list of the products sold, vitamin A was pretty close to the bottom. It wasn't one of the big sellers, if you like. And we had made our A from retinol palmitate and put it into walnut oil. And, I was very happy. It seemed to work well in the few people that showed positive to it. But I now realise there's a lot of people who are A deficient, and we're not hitting the right substance, the right type with it. So let's have a look again, the same sort of map here. Diet. Vitamin A, quite difficult, like D, to actually get enough of. And the major source of it, of course, is liver, because that's where we store it, that's where the animal stores it. So again, cod liver oil, things like that are good sources, halibut liver oil, fish liver oils. But people don't eat fish liver oil, really, do they? Okay, so when did you last eat liver? Who eats liver here? Oh, good, excellent, good. Okay, because liver is a very good source of it. So you need to eat liver, but always eat, again, organic, because you've got all your pesticides and things in there. And the highest of all liver is turkey liver. Turkey rules supreme after cod liver oil, of course. But cod liver gives you high D and A. So if you're looking at A, you may not want the D to be high with it. Okay? But certainly with liver, turkey followed by chicken. Okay? Now, I've never seen turkey livers, not organic. Okay? Never. You can buy them in America, apparently. because they eat more turkey than we do. But even at Christmas time, I've never seen turkey liver. So all those organic turkeys, I don't know what they do with the livers. So somebody can make a lot. So, what?
Probably make them into pet food.
Probably, yes, yeah. Well, Jill makes a lovely chicken one. Do you want to just tell them how you make your chicken liver pate?
Chicken liver pate?
Yeah.
Alma, really. Alma said you just fry it. Is Alma gone?
She's gone, yeah.
Just fry it in chicken livers with a few onions. I was following a recipe before, and it was very intricate. Just fry up the chicken livers with some onions, throw it in your blender, put in a few herbs, and put it in the bowl. That's what I do now.
Yeah.
Seasoning, and that's very quick and easy.
Yeah, dead easy. It goes down a treat. It's delicious, yeah. Don't keep it for too long. It starts to have a bit of an aroma after a few days. But the first day it's amazing because it doesn't really smell at all, does it?
It gets stronger, doesn't it? As it gets older.
Yeah. And you can buy organic. You buy yours from a supermarket beginning with W. They do organic. They do organic chicken livers, yes. Yes, okay. Right, that's not Woolworths. Okay. So, diet. Now, we have it from fishy puzzling livery things there, and we also make vitamin A from a whole range of carotenoids. So we can make them from beta-carotene, from different carotenoids, of which there are quite a number. But the conversion of carotenoids is not as efficient as what they first thought. That they thought that beta-carotene would actually give you 2 retinol units, which was very, very good. But now they're debating whether that actually is the case, and it may be much less than what they first thought. So we get vitamin A normally from our diet within certain foods, but only animal foods. Okay, we give you vitamin A. All plant ones contain carotenoids. So if they tell you, oh, this contains vitamin A, that is not true unless you count carotenoids as part. Really, it's a pro-vitamin. Carotenoids are not vitamin A. They have to be converted. And they're converted to a different pathway than the fats that we get from our diet. So the normal vitamin A that we get from our diet is called retinol palmitate. It's an ester form because it's stable. Okay, this is what you get in your livers, etc., and any food that you eat. This is then oxidized in the small intestine, possibly, and I don't know how, this is possibly by bacteria, but we do need bile in the process, and we need zinc to convert retinol palmitate into retinol, which is generally considered to be vitamin A. That's known as retinol units. Okay? Now, retinol is then converted on to all trans retinol. Retinol is an alcohol. Okay? So this alcohol is then oxidized to retinol, which is an aldehyde. Okay, so this is an aldehyde here, all trans retinol. And that all trans retinol is then isomerized to cis retinol, which is what is the visual pigment or rhodopsin in the eye for vision. Okay? So when it comes to vision, this is the pathway we use. We use retinol. Okay, and that's the major area in the body that it's used. Vitamin A is used as retinol. The rest of it goes to using it for bones, teeth, immune system, gene transcription, skin, cellular health, embryo, reproduction, and the formation of blood, red blood cells. Okay? So this is important in hypoxia, very, very important in hypoxia, and because it actually goes to make red blood cells from the bone marrow itself. So vitamin A has tremendous amounts of functions, just like vitamin D. Okay? But the one that does that is the conversion of the aldehyde into all-trans retinoic acid. And this is a one-way step. This one we can convert retinol, which is more or less again like the storage form that we saw with vitamin D, into all-trans retinol and then on to the retinoic acid. The retinoic acid is the one that does all the gene transcription, and the important thing, it matures the keratinocytes to make nice skin. So all our skin, which Jill talked about, and our hair and our teeth, all use keratin, nails. And to get keratin to mature those proteins, you need the vitamin A. So one of the things you get is rough skin. You get immature skin, And this is one of the fundamentals where fungal spores and funguses will attack. So one of the things we've discovered here is that people who get chronic fungal problems in the gut and the sinuses will usually show positive to having a deficiency of retinoic acid. Okay? Now there's a secret to knowing why this is or how it is in a moment. So this conversion of carotenoids goes to the all-trans retinol here, and this needs a dioxygenase enzyme, and dioxygenases use iron as the electron donor. Monooxidase, which we've talked about before, need copper, but this one is a dioxygenase, and you need iron and oxygen to convert carotenoids into retinal. Retinal then goes on to form retinoic acid. So all these functions here are of retinoic acid. So retinoic acid is the active form.